Recognizing the member for Chilliwack-Kent.
Thank you, Honourable Speaker. I've described that young people are facing more stress and anxiety than ever, and I want to turn back to the McCreary Centre's 2023 BC Adolescent Survey, and more specifically, an article that was published just a couple of days ago written by Laurie Colbert, titled "Stark Reality for Non-Binary Youth," discussing youth mental health. Gender-diverse teens make up just 5% of the 38,000 respondents, but as Nick De Leon, a University of Fraser Valley student who identifies as non-binary and genderqueer, shared in the article, that 5% is made up of youth, and youth who are struggling. The article goes on to describe the impacts when home doesn't feel safe, the effects of polarizing social and political landscape, and how that contributes to poor mental health outcomes. Colbert also highlights Dr. Elizabeth Sawick, director of UBC's School of Nursing, who shared, quote, "It is really hard to be in the world and hearing people say you don't exist, or you don't deserve to exist, or you shouldn't be supported and respected. That can be really demoralizing for people, and that has consequences." But Dr. Sawick also highlights that, quote, "Contrary to the stereotypes out there, being trans or non-binary is not automatically everyone is going to be struggling. The majority of gender-diverse young people who are supported by family and school are healthy and doing well." The article goes on to share that although non-binary youth had higher levels of stress and were more likely to self-harm, that these risks can be mitigated by the presence of loving adults in their lives, be it parents, teachers, coaches, or neighbors. The piece also includes solutions in schools and communities and describes actions that can contribute to improved mental health and well-being for non-binary students, like gay-straight alliance clubs, LGBTQ+ inclusion policies, gender diversity curriculum in schools, and more gender-diverse washrooms in public buildings to boost inclusivity, just to name a few. Several people sent me this article on the weekend, and I asked one person who did, a non-binary youth, what they thought of it. They said to me, quote, "I guess I'm glad that we have the data to show the impact on the mental health of youth, but it's also scary, because it shows that the hate and talking like we aren't human and wishing we didn't exist, well, sometimes it makes us not exist. I don't want them to feel like this is proof that hate is working. It's scary because this makes them maybe think that they just need to hate harder or scare more people, as if being me is contagious." So as the MLA for thousands of youth in Chilliwack-Kent, as the parliamentary secretary for hundreds of thousands of youth in BC, as the mother and example for 2 young adults, I'll take a moment to say this to our youth. You matter. This province and this world is better with you in it. And to the rest of us, youth mental health is a life or death issue. That includes two-spirit, non-binary, trans, and gender-diverse youth. It includes all our youth with all of their beautiful intersecting pieces of identity. What we say in our homes matters. What we include in our schools matters. What policies we make, what rhetoric we accept, and what we say in this chamber, it matters. Thank you.
Thank you, member.